And I hope you can, okay, I think you can see my slides and um, I think, please let me know if you can't hear me. Um, but welcome to everybody who's online today. There's a lot of people online, including some new trainees, Flossie and Angeline, and some people existing in the program and people as far away as as Honiara. So welcome everyone. Today I wanted to just run through an overview of pediatric training for this year, and it's really just to get you thinking about, excuse me, get you thinking about how you'll structure your learning for this academic year, which starts in, now or in another couple of weeks. But I want you to start thinking and have a plan for your academic year, whether it's at a Diploma of Child Health or a Part 1 Master of Medicine or a Part 2 Master of Medicine. You need to have a plan for how to do that. So this is just an overview of pediatric training in 2025, and we'll make a start. I'm just going to outline the curriculum somewhat, and it's become much more complex, the curriculum, and I'll explain why. I'm going to talk about the many ways to learn because we often think we can only learn by listening to lectures or something. It's not true. There's so many different ways to learn. I'm going to say something at the end about supervision and mentorship, and I'm going to try to explain why pediatric training, just like any other specialty training, and even medicine itself, it's a marathon, not a sprint. So you need to sort of take your time and go. Anyway, we'll talk about that. Let's start with the Diploma of Child Health. The Diploma of Child Health has been in place for about 30 years, and it's really an introduction to pediatrics. And the what you have to do at the end of it is really to be a good clinician who can look after sick children. You don't have to have all the skills that a pediatrician would have, but you have to be a solid, good clinician who can look after children in a ward. Now, most people who start the Diploma of Child Health would like to go on and do the Masters, and we'd like them to as well. But a few people over the years have done the Diploma of Child Health and then decided that they'd like to be a rural doctor or to be something else, but they still have a Diploma of Child Health that they can take, and that gives them the skills to be able to look after sick children and run a district hospital children's ward or be competent in looking after children. So we want you to, at the end of it, to be a good clinician who can look after sick children. Having very you don't need to know about really rare conditions, but you need to be competent in all the conditions that are included in the standard treatment manual and all the common conditions of childhood. There are some learning ways you can, I think there are some ways you can learn about how to go through the Diploma of Child Health. One is um, using the WHO Hospital Care for Children um, teaching. And now online, we've got modules, teaching modules for each of these common conditions. So cough and difficult breathing or severe pneumonia, diarrhea and dehydration, fever in an infant, fever and encephalopathy, that is fever and seizures or fever and coma, and malnutrition and HIV. And when you think about it, in our children's wards, a high proportion of the children that present to um, our hospitals have one of these presenting problems. They have one of these things. So this covers like 80% of what pediatrics is. And when you're doing the DCH, again, we want you to be a competent doctor who can look after sick children. For the Diploma of Child Health, you have to do a research project, and that really again is an introduction to research. It's not that you have to be doing a PhD or something. It's really an introduction to research, and we want you to learn how to do research properly. So we want you to do a basic research project. Realistically, you've only got about 3 to 5 months to do the research project, because even if you started planned it now and then started in next month, then in 5 months' time, we'll be around, July, and then you'll be starting to think about stopping your data collection and writing up. So because you need to have written up somewhat substantially by September for the for the presentation of the research project. So it shouldn't be a rush, but but you should take on a project that really can be done in about 4 to 5 months. That's all. So we're not wanting something very complicated, just something that gives you a good introduction to basic research methods. And we'll teach more about that as we go along. Excuse me, I've got a bit of a cold. Um, that for those who are doing the part one, that's beyond the year beyond the Diploma of Child Health. So people in the training program do the Diploma of Child Health and then they do a part one. And the part one is partly common to all the postgraduate disciplines. So whether you're doing surgery or adult medicine or obstetrics and gynecology, at least part of it is it's called a common core, which is the basic sciences behind the discipline of health and medicine in general. And for those who are doing the part one, then you'll be needing to study these all the basic sciences, anatomy and physiology and biochemistry and those things. It's a lot of what you learned as a medical student, but in a bit more detail and a bit more applied because you've got that knowledge behind you about clinical things and you can apply that knowledge, apply the basic sciences knowledge. So it looks like a lot of the curriculum looks like a lot of different topics, but if you systematically go through it week after week, then you'll be fine with that. You have a lot of pre-existing knowledge about these things, and by the time those who get to the part one, you'll be fine with it. But it covers cell biology and nucleic acids like DNA and RNA and genetics and protein synthesis within cells, the basics of genetics, hormone function, glucose homeostasis, neurosciences, biochemistry, and oncogenesis, like cancer genesis. So that's the common core. And then something you'll be more familiar with for those who are doing the part one will be the basic anatomy and physiology and pathophysiology surrounding common childhood illnesses, whether it's respiratory physiology or cardiovascular physiology or neurosciences or gastrointestinal function or genetics again, or endocrine and hormone function, hematology and immunology and HIV. They're the specialty core topics that for those who are doing the part one, we can talk more about that later. But the part one essentially is the basic sciences behind the discipline of pediatric and child health and medicine in general. And there's two streams to it. One is the common core learning and the common core part to the exam, and the other one is the specialty core learning and the specialty core part to the exam. And if you were doing surgery, then the specialty core would be, surgical topics, and if you're doing obstetrics, they'd be more maternal and obstetric topics, midwifery topics, etc. So that's the structure of the part one. We can talk more about it later. And then the part two, for those who go on to the part two after the part one, which we hope you all will, this is it's a continuation, it's a continuum, if you like, of learning. And it's really in the part two, you're developing more skills to be a pediatrician. You're already a competent clinician and you're developing more skills that will enable you to be a pediatrician. And these skills are, I mean, again, it seems like a long list, but they're a bit overlapping and they're all the skills that someone who's a pediatrician needs to have a good understanding of. Firstly, a knowledge of pediatrics, of course, and clinical skills. As you progress through your training in the last year or two, you'll get more exposure to certain specialty areas, like a bit more neonatology, a bit more oncology, um, uh, what else? What else? Cardiology. You'll get more exposure to, hopefully, some intensive care. So they're the specialty areas. But generally, in the part two, it's developing the skills to be a pediatrician. Most importantly, a knowledge and practical skills in pediatrics. Covers emergency and intensive care, the care of children with chronic illnesses or chronic conditions. This is increasingly important. No, pediatrics has gone beyond a situation where all the children we're looking after have acute infections like pneumonia and diarrhea. Many of them have chronic conditions, either chronic infectious diseases or chronic non-communicable diseases. We'll again talk more about this as we go through the year. You'll learn during your training, the 5 years of your training, about procedural skills. And it's important that we all have good basic procedural skills, whether it's um, things like just intravenous insertion or central line insertion or putting in chest drains or echocardiography, ultrasonography. I mean, all of these things you will learn throughout your training. Then you learn some other sort of professional skills, I would say, that are really important. So things like problem solving and decision making, these are things that you should make you a good pediatrician. Ethics is important too, and we'll cover that. And then not forgetting that not all pediatricians function in a hospital setting. Many pediatricians increasingly and in the future will function at a community level, whether it's as a general pediatrician in the community or whether it's a pediatrician in public health. They're very important. So to get an understanding of the population of children in the community and how to enhance their health and well-being is very important. And to get a good overview of public health in Papua New Guinea and Solomon Islands, I think that's very important too. So we'll teach that. And then throughout your training, throughout the part two, you'll learn skills in research and epidemiology. And a good pediatrician has to be a teacher as well. So during your training, you should take opportunities to do teaching, and that can be an informal sense, teaching your residents, or teaching nursing staff, or teaching your colleagues who are also in training. But try to learn the skills of teaching so that that can be part of your overall skill set when you finish the Masters of Medicine. Now, I've made it sound like a lot of things to learn, but don't be overawed by that or don't be put off by that because progressively you just accumulate these skills and this learning as your training goes on. And finally, on this matter, don't think you have to learn everything by the end of your masters. You don't. You really, not at all. In fact, most of the learning happens after you finish your specialty training. I can tell you, most of it happens in the 5, 10, or 20 years after your pediatric training. The pediatric curriculum, I won't go through all of this, but the lectures that I've given in the last 5 years now, and we'll give again this year, but are also online now. They're all online for you to look at. These are the lectures. There's more of them, but they cover a whole range of pediatric topics, and we will cover all the things I've just mentioned, both the basic science behind the diseases and the science, whether it's pharmacology or some other science behind the treatments. We'll cover all of this in the next year. So again, don't be overawed. The lectures are all online, as I said, but we'll have a lecture every Monday. But if you want to just go back over the back catalogue, if you like, of lectures, I think it's quite useful to do. Um, there are at the moment 118 lectures online, but there's about 50 in the series because some are repeated year after year. But ideally, if you're going to go through these, watch the ones from 2024 and 2023 because that's a more or less a whole lecture series, those 2 years. And most of the ones in 2022 were repeated again in 2023 and 2024. So start the ones from last year and the year before and look at those. Yeah. Also included in this online in this on this link some basic science lectures like specialty core part 1 lectures in respiratory physiology and cardiovascular physiology, neurology, hematology, immunology, etc. And there's also some lectures on epidemiology and research methods. There's 3 of those, I think, or maybe 4. But there's also a course that we'll run in March, towards the end of March, on epidemiology and research methods. And then finally, for those who are doing their, especially their DCH, have a look online on this link and you'll see 6 different modules about hospital care for children. And I did them late last year. We've been running this course, the Hospital Care for Children course, for many years now, and I just thought it would be good to put some online. So I've updated the lectures and put them online, and you can you can watch them if you like. Right. But I wanted to say that listening to lectures is just one way to learn. There are so many different ways that you can learn. I'm going to go through some of these in a bit more detail. But there are many, there's about 12 here. I think 12, at least 12 different ways that you can learn that are not just about listening to lectures or watching lectures, right? So the first way is to learn at the bedside. And we learn most of what we know from, I would say, it's called triangulating information. You read about something, or you listen to a lecture, or you watch a podcast, and you see a patient, and then you read something more about the disease. The triangulation of that information in your mind is really helpful for learning. But there are some skills you need to learn about at the bedside so that you can maximize what you learn from your patients. And I think the first skill is to try to learn how to talk to children. This is really important. That we don't teach it to medical students enough, and most people in other specialties they haven't learned this skill. They learn other skills, but they haven't learned this skill. But I find it very important to learn how to talk to children, and you can do this in it's not something you are born with. You can learn this. You can learn how to do it. And first of all, there's some principles. Firstly, ask familiar questions that'll make them feel safe. When children are in hospitals, they're often quite intimidated. They've got strangers around them all the time, and they need to feel safe. Very, very important. And so I always ask them just familiar questions that you know that any child would have some they'll understand. How did they sleep? That's what I often ask children when I first see them in the morning. How did you sleep? Because that shows that you're interested in them, you're caring about them, right? You're not jumping right into their disease or something, which is not of the great interest to them. You're asking them how they are, how did they sleep? Are they feeling hungry? Have they eaten this morning? Basic things like that. I often also, when you're in hospital, you often get you often get disorientated, disorientated in time and place and day. And of course, not all children are old enough to know the day or the date or the time or what it is. But if they're old enough, then I always tell them the day. It's Wednesday morning and or it's Sunday morning. Good morning. You can sleep in a bit because it's Sunday morning. Say something about the weather or orientate them to the place they're in. Say you're in the hospital and you'll be here for, a few days until you get better. I always try to ask them about things that I know they'll know about, depending on the child, but, ask them about their siblings or whether they have some pets at home or what are their interests or what do they like, do they like sports or what do they like at school? If they, especially for girls, but not only anyone, compliment them on their clothes. If they've had a shower and they're all dressed up, for the morning, then compliment them on their clothes or their nail polish or their hair or whatever. It's just a way of making children feel safe. Reassure them that they'll be home soon because children, when they're in hospital, they've got no idea just how long they're going to need to be in hospital. Maybe their parents don't know either. And so I always reassure them that they'll be home soon and that their parents will be with them all the time so that they, again, feel safe. They have an anchor point, which is their parents usually. And then ask them if they have any questions. Now, I've gone through an exhaustive list about how to talk to children at the bedside, but and you don't for every child you don't need to go through all of these things, but just one or two of them can make such a child feel safe. Now, you also need to learn how to examine children. And this is really important, especially for young children. This is Dr. Janelle Solomon, and she's taken up exactly the right posture to examine children. I often see doctors leaning over a child. That's a very intimidating posture. So get down to their level. If you're at that level or even a little bit lower, then it's non-threatening. Even the most the child with the greatest stranger anxiety will generally calm if the person who's approaching them is down at their level or a little bit lower. And so it's less threatening. You get more clinical information because you can just watch what the child does. And also, if you bend down like Janella is, then you can keep a straight back. You don't, this might seem a trivial issue, but as you get on in medicine, if you are leaning over a bed all the time, then especially with the low beds that we often have, then for children, then you'll get back strain, and it can be very damaging. So strengthen your legs and squat down often when you're examining children. Also, when you're examining children, be opportunistic. You get most information from standing back and just watching a child. And even though it's different to an adult exam where you have to go through it in exactly the right order. What you have to do when you're examining children is be as opportunistic as you can be, examine the things that are least threatening before the more threatening, and then in the end, you need to be very systematic. You need to put that all together in the right order. Now, I've skipped over a lot of the details of this, but again, these are skills that you'll learn as you go through your pediatric training. But unless you start trying to understand these things right from day one, then you get into bad habits. Like you fall back into I would say the adult medicine habits of just standing at the end of the bed, just making wise pronouncements and not actually engaging with children. You should engage with them, and it should be fun. I mean, mostly, not always, but mostly it's fun. Occasionally you get a child who just keep incessantly crying, but mostly it's fun. You're also trying to give confidence to their parents. And whether it's the mother or the father, you want to give them confidence that you have competence to look after their child and to examine them properly because they're giving their consent for you to engage and examine their child. And that's important. Okay, right. The other way to learn at the bedside, I've talked about the pediatric skills you need, but the obvious thing is when you see some disease or a child with a certain disease, then read around the problems you see every day. I find I learn much more by if I see a case that I've never seen before or not quite in the same way, I then go and read around it. One, that helps me look after the child I'm looking after. And two, it helps me remember things. So you should discuss cases together with your colleagues and do some, I would say, opportunistic reading of textbooks. Like if you see a condition or a disease, then look it up in the textbook and read about it or look it up online. Sometimes if the condition is uncommon or rare, then doing a PubMed search. I'll talk to you a bit more about doing PubMed searches as we go through learning about research and epidemiology, and ask a professor or a senior for a tutorial on that topic. Don't let a good opportunity at the bedside go to waste. Maximize it by reading about it, discussing it, hearing from a professor or whatever about what their understanding of it is, etc. So use every opportunity at the bedside. I think it's very important that we all carry a guideline with you. You should carry a guideline and refer to it often so that you are really good at navigating through that guideline, whether it's the standard treatment book or the hospital care for children book or both. They're a bit different. Then really learn how to navigate using a book that will. It's a good fallback. You know, I don't try to commit too much about, for example, drug doses or things to memory. I know some because I'm using them a lot, but a lot of things I don't commit to memory because I know how to look them up in a book. It's easy to look them up in a book or even these days look them up online or on an app or something. But learn how to navigate these resources we have. Um, uh, and as I say, for the hospital care for children, do the course. And you can do the course a bit online these days, as I said, because those 6 lectures are there. But there's still other things that you can learn. All right. Now, I talked about opportunistic reading before, and that is there's some good textbooks you can get that you can look things up in. And sometimes they're big, thick textbooks, but I wanted to try to just explain about just a couple of textbooks that I think are good that you can do more systematic reading. So there's opportunistic reading where you look up a certain topic, and then there's systematic reading or comprehensive reading where you start at the start and go right to the end, and you make notes along the way. You might make annotations in the book, or you might make you have a notebook where you're making notes. And the two or three books that I think are the most useful, they're I would say easily digestible. They're not very thick. They're very practical. They're very clinically orientated. One's called the Illustrated Textbook of Paediatrics, and it's a UK-based, a British-based book, and it's by Lissera and Carroll. It's got the sunflower on the front and the bee. And the other one is Practical Pediatrics, which is the Australian textbook of pediatrics, which also is very good, excellent. But both of these are excellent books. Um, there's another one called Essential Pediatrics and Child Health. It's a UK-based one. That's a bit harder to get, and the last edition was quite some time ago. The most up-to-date one is the Illustrated Textbook of Pediatrics, Lucera and Carroll, and it's got good illustrations along the way that helps you. I think you don't want just text, you want illustrations to help you learn things. But at some stage in your training, and you need to read from the start to the end of a pediatric textbook. So there's opportunistic training where you go in and just read things about the diseases you're seeing, but at some time you need to read all the way through a textbook. And you can make that fun by taking notes, etc., along the way. Okay. There's a lot more resources online, and I just point you to the Pediatric Society of Papua New Guinea website, where there's a lot of other guidelines. There's the book, the e-copy of Pediatrics for Doctors in Papua New Guinea. That's been out of print for a long time now, but the e-copy is online. There's a standard treatment book. There's the e-copy of the Hospital Care for Children book. There is a curriculum for Diploma of Child Health and Master of Medicine. That's a bit out of date now, so more of what I'm saying to you today is a bit more up to date. There's some other good resources, including the National Child Health Plan 2021 to 2030, which is if you want an idea about child public health and the way health services are structured in Papua New Guinea and the plan for child health in the next decade, then that's a good thing to read. And there's some other tools that during your training you'll find useful, tools for pediatric surveillance and morbidity and mortality meetings. I'll talk a bit more about them soon. So some of these other guidelines include the HIV guidelines for drug-resistant TB, nutrition guidelines, guidelines for child protection. So all of these guidelines are on the Pediatric Society website under treatment. Have a look at them. They go out of date rather quickly, but we try to update them whenever a new guideline comes out about. For example, in the last year, there's been last couple of years, a new guideline about HIV care, and that's on the website. There are also the training modules for hospital care for children. So I won't go through them, but they're all online now, and they were many of them were last updated even just last year. So I would encourage you to go online and have a look at those at some stage. There's other ways to learn too, and in your hospitals, I'd encourage you to be engaged, to get involved in your child morbidity and mortality meetings. I think that's a very good way for registrars to learn. You can learn about the diseases, you can learn about quality improvement, you can learn about the clinical lessons that arise from different cases and the process by which we need to make improvements so that certain things don't happen again. There's a lot of learning that can be derived from child morbidity and mortality meetings. There's a lecture about this, which I think is very important, that all our registrars get expertise in auditing and child morbidity and mortality meetings. I hope your hospitals will start case presentations, or if you don't already do it, but once a month or so, you should have an interesting case presentation where all your team get together and you present a case and you discuss it. I often find it quite useful to do it about a challenging case that's still on the ward, for which there are questions about how to manage the patient. And you can then, rather than just keep managing the patient by yourself or just one doctor managing, then there can be a lot of input from lots of staff. I think that's a useful thing to do. So, and to do that, you again read around the topic, you summarize the topic, you present the case, identify the specific problems you need help with, and people may have some input into that. So having a monthly or even a weekly case presentation, it doesn't have to take up a lot of time to do that, to present a case, because having looked after the patient, you know them very well. Again, it's not necessarily that you have to have PowerPoint even. We often have case presentations where the case is just discussed rather than presented with PowerPoint slides and things. Um, I talked a bit about procedures and other things before, but in pediatric training we have a logbook, and the reason for having a logbook, it started many specialties like surgery and anesthetics, they have logbooks, and they log operations they've done or anesthetics they've given, and I think that's very useful because it acts a bit like a diary. It allows you to remember the things that you've done before. It's not something that it's not marked or judged. Um, uh, it's not a, but it's a bit like keeping a diary regularly. And the logbook for pediatric training, is designed to be used throughout the 4 or 5 years of pediatric training, commencing in the Diploma of Child Health year. And you don't have, it's not an obligation to fill it all out in 1 year. It's really something that you should use throughout your whole training, and just progressively add to it. So that by the end of your training, by the end of the 5 years, then you've got a fully completed logbook with which will document the cases you've seen, not all the cases, but interesting cases you've seen, the procedures you've learned and practiced, courses you've attended, your research projects, the jobs that you've had along the way, the places you've worked. And I think it can be a good way to keep a track of what your training is, and also then you can discuss it with your supervisors, and you can discuss a lot of things. You might discuss where there's a gap in your training, you haven't done a certain course, or you need to skills in a certain area. And I think you and your supervisor should review your logbook as part of regular supervision. Once every month or a couple of months, you should ask your supervisor to sit down with them and just talk about your training. Whether it's every few months, I think it's a good idea. It is like a diary. It's your own personal record of what you've seen and the lessons that you've learned. There's no right or wrong answer in a logbook. It's your own personal record. I also find I can't remember everything about all the patients I've looked after, so it's useful to write it down and keep a logbook. You could do it electronically if you wanted. There's a Word version of it. You could do it like that, or you can just write it in. And it allows you to build your knowledge slowly. One case informs the next, because if you see another case that's the same, then it'll help you manage the next case. Because you'll go back and think, oh yes, I remember that case from a couple of years ago. Other ways to learn are reading pediatric journals. Now, these days, there are so many different journals. There's thousands of journals, and there's probably hundreds of pediatric journals, and you can't read all of them, and nor would you want to. But I think there's a couple of 2 or 3 very good journals that it's useful to read. I started reading this one, the first one, Archives of Disease of Childhood, when I was a resident as well, and I still read it now. The Pediatrics and International Child Health, that's another quite good, more clinically orientated journal, and the Journal of Tropical Pediatrics, I find that quite useful as well. Some of these days are online, some of them are open access and freely available. And but I think it's a good idea to you can subscribe to the table of contents of any journal for free, and you get monthly, you'll get a table of contents, and you can just go through it and find what articles might interest you and and read those. Okay. It just gives you a bit more of an understanding of the way pediatrics is in other places, and you're not always so internally focused about the cases you're seeing. Just wanted to touch on the part one assignments, which I sent an email on the 14th of January about this, but and I won't go through it now, but there are 14 assignments that you need to have for those who are sitting the part one, you need to have completed the majority of them to sit the exam, and so I won't go through these, but the email contains the part one assignments. So please have a look at that email from the 14th of January. And lastly, I wanted to say something about your supervisors and what the differences, if you like, between a supervisor and a teacher and a mentor. Now, the supervisor oversees your training and supports you and instructs you and teaches you and assesses you sometimes. A teacher may teach in different ways, formally and informally. They may not even know they're teaching you, but they will be. And then a mentor, it's a bit different. It's a supportive and additional advisory relationship. It may be a senior trainee or a recent graduate or an experienced pediatrician. It may be a person in another discipline that you have a link with, you have an intrinsic link with. But I think everybody needs a supervisor teacher and everybody needs a mentor. And they could be the same person or they could be different people. But throughout your training, I think you need to, you have a supervisor SMO, but also consider who might be a good mentor for you and try to identify who that could be. We can talk more about this. I've just given you the an overview, the broad brush dot points, if you like. A mentor is someone who's interested in you as a person and is willing to understand and help you throughout your training. Not just someone who's interested in you professionally, but interested in your whole life, essentially, your other things that matter to you. And that brings me to the last point that I made at the start, that postgraduate training is a marathon. It's not a sprint. And so I've said a lot of things today in an hour. Less than an hour. I've described the whole program, but you take your time, and there's work and there's life, and you need to look after throughout your training the other important things and people in your life. Don't get too bogged down with work and only work and study and that sort of thing. Obviously there's other important people and things in your life, and you need to balance those things. You should enjoy your training. Every job I ever did, I enjoyed. I tried to enjoy because I think it's you want to be happy in your vocation. We are very privileged to be doctors and to be in postgraduate training, and you should recognize how fortunate we are to be in this position. But on the other hand, not on the other hand, but sometimes pediatric training is tough. It can be sad and it can be confronting, and it can be you may face great tragedy because we're looking after the sickest of children. And sometimes you might even doubt yourself, your own competence, your own abilities to, be a good doctor. Well, don't worry. Everybody goes through that. Everybody doubts themselves along the way. And so realize, firstly, that that's very normal. And also realize that there may be times when you need to take a break to deal with other things in your life. We've had lots of trainees who've taken a break, like a year off their training, during their training, in their 5 years training, had a year off, and they've come back even stronger and they've become very good pediatricians. So don't worry if if it's difficult at times, but seek out people who can help you. Know that there's always someone there who you can talk to if you're struggling for whatever reason, socially, financially, academically, clinical work, ethically, whatever, moral. People struggle in lots of different ways, and but pediatric training should be fun. All right, it's a great privilege, but there's always someone who you can reach out to and talk to, and try to look after each other. I've talked about um, forming a study group, and I think that increasingly our trainees should do that. We have 30 trainees in the program now. I think there's 30 trainees at all different levels, of all different levels this year. And it would be very helpful if there was like a part one study group and you could work out how to do it with WhatsApp or a WhatsApp group or, a Zoom meeting or something like that. But you guys can work out your ways. But I would encourage you to form a study group, whether it's at a DCH level or a part one level or a master's level. Try to form a study group so you get to know each other and you can look after each other and learn from each other. Right. That's all I really wanted to say today. I hope some of it's been useful to you, and I'm happy to answer any questions, but it was really just a broad brush overview of what postgraduate pediatric training is like, and I hope you're enthusiastic about it as I am. I'm going to stop the recording now, and I'm happy to answer any questions that you might have.